Welcome clients and guests to my channel. I'm Jason Serro and I'm a licensed professional counselor. My videos are designed to educate and empower you to make informed decisions about your mental health. There is no single best approach to treat depression. No standardized treatment for depression. It requires a comprehensive plan to cover an individual's unique treatment plan. Talking with a quality therapist really helps. I see such relief even after the first session. Cognitive behavioral therapy is a great modality that can assist you with getting your thoughts, emotions, and actions in sync. Dialectical behavioral therapy is another modality that assists with you being more mindful of what's happening inside of you and helps you become more present and current in many aspects of your life. We often spend too much time wasting away thinking about the past and future. I have a whole series on dialectical behavioral therapy, so check out those videos when you can. There is no cure for depression, especially when we talk about antidepressant medication. Neurotransmitters like serotonin are chemicals that relay messages from neuron to neuron. An antidepressant medication tends to increase the concentration of these substances in the spaces between neurons, the synapses. Enough of an impact occurs so that the brain can function better. Medications can help you manage sleep and appetite issues. Medication has the highest form of relapse. It's not enough, and they can have some nasty side effects. Antidepressant medications' main aim is to relieve symptoms of severe depression. The most commonly used antidepressants are tricyclic antidepressants, TCAs, selective serotonin reuptake inhibitors, SSRIs, and selective serotonin noradrenaline reuptake inhibitors, SSNRIs. About 40 to 60% of people see an improvement in their depression symptoms within 6 to 8 weeks. To build a compelling future, don't focus on the unchangeable past. Instead, focus on present realities and the possibilities of your future. Learn ways to manage stressors, and one technique you can implement is called behavioral activation. It is trigger, response, avoidance patterns, known by TRAP. Trigger, response, alternative coping is known by TRAC. To sum it up, something happens to you. You have thoughts and emotions connected to the event, and then you respond by avoiding, escaping, or withdrawing. Counteract that by implementing some alternative coping strategies by asking yourself, what can I do that will be more helpful to myself? How can I act in a way that is respectful of my values? And what is the wisest choice even if I don't feel like doing it? For example, your partner makes a passive-aggressive comment to you about not contributing to the household tasks, or criticizes you for doing something wrong, or doesn't really pay much attention to you and is on their phone for hours. You feel hurt and fire back an insult of your own, and then you dip and are gone for hours without communicating a word. Assuming this is a pattern with your partner, it's safe to assume nothing good has come of it, hence the pattern. Using the TRAC method, an alternative coping strategy is to express to your partner that those comments really hurt you and make you turn away from them. This would be more helpful to yourself because you would finally be telling them something they didn't know and dealing with the problem head on. Assuming you have a reasonable partner, this can spark a dialogue that can probably involve you both expressing your frustrations with each other, but hopefully in a way that motivates you both to make some changes with your communication and your behaviors. In my series on depression, I will create videos that include postpartum depression, seasonal affective disorder, dysthymia, bipolar disorder, and cyclothymic disorder. Be sure to keep a lookout for them in the near future. Thank you for watching, and as always, be where you are, be resilient.